What if the journey to motherhood could turn into a fight for survival? Picture a hospital room, a new mom holding her baby, unaware that the next hours or days could bring life-threatening complications. The reality of pregnancy-related deaths and illnesses is a hidden crisis, claiming lives and exposing deep inequities that demand our attention. Welcome to the Healthy Start channel, where we shine a light on the health issues that matter most. Today, we're diving into a critical study from JAMA Network Open, unpacking why maternal mortality and morbidity are rising, who's most at risk, and what we can do to turn the tide. This is a story of resilience, loss, and hope. Don't miss it. Subscribe to the Healthy Start channel and hit that notification bell to stay informed. Let's start with the stark truth revealed in a 2025 study published in JAMA Network Open. Between 2018 and 2022, pregnancy-related deaths in the U.S. climbed, with rates varying wildly across states, races, and ages. The study, a cross-sectional analysis of CDC data, tracked deaths during pregnancy, childbirth, or within a year postpartum, painting a sobering picture. In 2018, the national rate was 22.3 deaths per 100,000 live births. By 2022, it had crept up, with some states seeing rates as high as 47.9 per 100,000, more than double others at 14.6. Think of a young woman glowing with the anticipation of motherhood, unaware that her zip code or skin color could tip the scales between life and death. Over half of these deaths happen after delivery, often in the critical 6 weeks postpartum, when complications like heart failure or infection can strike without warning. This isn't just a statistic, it's a call to understand why this is happening and who's bearing the brunt. So, who's most at risk? The data lays bare stark disparities. Black women face the highest rates, with 55.3 deaths per 100,000 live births in 2022. Compared to 22.3 for white women and 17.4 for Hispanic women. Asian women had the lowest rates, but even they saw increases in some states. Age matters to women over 35 are more likely to die than younger mothers, with risk spiking for those over 40. Picture a 38-year-old black woman in Alabama, where rates are triple those in California. She's navigating a system where access to care, quality of hospitals, and even societal biases can stack the odds against her. Rural areas fare worse than urban ones, with fewer obstetricians and longer drives to hospitals. The study found that states with restrictive reproductive policies like Alabama had higher rates, while states with robust health care access, like California, saw lower ones. It's a patchwork of outcomes where geography, race, and policy shape survival. What's driving these deaths? The causes are complex, weaving together medical, social, and systemic threads. Heart conditions, including cardiomyopathy, top the list, accounting for many fatalities. Think of a new mom, exhausted but joyful, suddenly struggling to breathe as her heart falters. Infections, like sepsis, are another killer, often striking in the postpartum period when the body is vulnerable. Hemorrhage, blood clots, and hypertensive disorders like preeclampsia round out the leading causes. But it's not just biology. The study points to social determinants: poverty, lack of insurance, and limited prenatal care that amplify risks. Black women, for instance, are more likely to face chronic conditions like diabetes or hypertension, which pregnancy can exacerbate. Add in systemic issues like hospitals with fewer resources or biases that lead to dismissed symptoms, and the picture grows grim. Posts on X, like one from @EP in February 2025, highlight how the racial gap in maternal deaths widened during this period, with black mothers dying at disproportionate rates. Let's zoom in on the postpartum period, where over 50% of deaths occur. The first 6 weeks after birth are a delicate time. A woman's body is recovering, hormones are shifting, and new responsibilities like breastfeeding or sleepless nights can mask warning signs. Picture a mom at home, feeling dizzy or feverish, brushing it off as normal until it's too late. The study found that many deaths in this window are preventable with better monitoring and access to care. For example, postpartum checkups, ideally within days of delivery, can catch issues like heart failure or infection early. Yet, many women, especially in rural areas or with limited insurance, miss these visits. Medicaid, which covers nearly half of U.S. births, often ends 60 days postpartum, leaving gaps in care right when risks peak. States like California have extended Medicaid to a full year postpartum, cutting death rates, while others lag behind, leaving women vulnerable. Now, let's talk about the role of policy. The study's timing 2018 to 2022 overlaps with significant changes in reproductive health laws. The 2022 Supreme Court decision overturning Roe v. Wade reshaped access to care, particularly in states with restrictive abortion laws. These states, like Alabama or Mississippi, often have higher maternal death rates, partly because limited reproductive care can delay or complicate pregnancy management. Picture a woman with a high-risk pregnancy, unable to access timely interventions because of legal barriers. The study doesn't directly tie these laws to deaths, but the correlation is hard to ignore. Conversely, states with expanded Medicaid, paid family leave, and robust maternal health programs like Massachusetts or Oregon see better outcomes. It's a clear signal policy isn't just paperwork, it's a lifeline. What about the impact of COVID-19? The study notes that the pandemic, peaking in 2020 to 2021, worsened outcomes. Pregnant women with COVID faced higher risks of complications like preterm birth or blood clots, and Black and Hispanic women were hit hardest due to disparities in healthcare access and higher exposure to the virus in essential jobs. Picture a pregnant nurse working long shifts in a crowded hospital, catching COVID and facing a cascade of complications. The virus also strained hospitals, diverting resources from maternal care and delaying routine checkups. Even as COVID's grip loosened by 2022, its ripple effects lingered, contributing to higher death rates in some states. The study suggests that better pandemic preparedness, like prioritizing pregnant women for vaccines, could have saved lives. Let's shift to the human side. Behind every number is a story of family left grieving, a child growing up without a mom. The study doesn't capture the emotional toll, but it's palpable. Think of a partner holding a newborn, grappling with the sudden loss of their loved one, or a community rallying to support a family, only to wonder why this keeps happening. These losses ripple outward, shaking trust in healthcare systems and fueling demands for change. On X, posts like at APs from 2023 and 2025 underscore the outrage, noting how Black mothers face death rates far higher than their white counterparts, a gap that's only widened. It's not just a medical issue, it's a moral one, calling us to confront inequities head-on. So, what's being done? Some states are stepping up. California's Maternal Mortality Review Committees analyze every death to pinpoint failures and recommend fixes, like training doctors to spot postpartum warning signs. Programs like the Black Maternal Health Momnibus, a federal initiative aimed to fund community-based care, diversify the healthcare workforce, and address biases. Doula programs, which provide emotional and practical support during pregnancy, are gaining traction, especially for Black and low-income women. Picture a doula at a bedside, coaching a mom through labor, ensuring her voice is heard. These efforts show promise. States with strong interventions saw death rates stabilize or drop, but progress is uneven, and many areas still lack the resources or will to act. What can you do? If you're pregnant or planning to be, prioritize prenatal care. Regular checkups can catch issues early. Know the red flags. Severe headaches, swelling, or chest pain warrant an immediate call to your doctor. Postpartum, don't skip follow-up visits, even if you feel fine. If you're a loved one, check in on new moms. Offer to drive them to appointments or watch the baby so they can rest. Advocate for better policies, support candidates or laws that expand Medicaid, fund maternal health programs, or address racial disparities, and spread awareness. Share this video, talk to friends, or post on social media. Every conversation chips away at the silence around this crisis. Let's zoom out. Maternal mortality isn't just a healthcare failure, it's a mirror reflecting our priorities. When Black women die at triple the rate of white women, when rural moms face longer odds than urban ones, when policy choices shape who lives and who doesn't, it's clear we're falling short. But there's hope in action. Every doula trained, every Medicaid expansion passed, every community educated brings us closer to a world where motherhood is safe for all. This study from JAMA Network Open isn't just data, it's a roadmap for change, urging us to listen, learn, and act. Health is more than survival, it's the chance to thrive, to hold a newborn without fear, to build a future together. As we close, reflect on this. Every mom deserves a healthy start, and every family deserves to stay whole. Let's commit to making that a reality through knowledge, advocacy, and compassion. Subscribe to the Healthy Start channel. Click the notification bell so you don't miss the next valuable videos. Goodbye and see you again.